We're going to continue talking about CNS pharmacology, and in this lecture we're going to focus primarily on certain drugs or a class of drugs that affects the GABA-A receptors. And as we discussed before, the GABA-A receptors potentiates the entry of the chloride ion into the cell. And this entry is facilitated by an ion pore that allows chloride to pass through this ion pore and enter into the cell. And due to the entry of chloride, it stabilizes the cell membrane and therefore clinically will create an inhibitory effect on the central nervous system. And this inhibitory effect can be thought of clinically as the manifestation of reduced anxiety, an amnestic response, sedative hypnotic, as well as an anticonvulsant effect on the central nervous system. Certain drugs that belong to the class of benzodiazepines, which would be midazolam, also known as Versed, diazepam, which is Valium, and lorazepam, which is a long-acting agent known as Ativan. And as we said, these drugs stimulate the GABA-A receptors within the central nervous system that potentiates the entry of chloride into the cell and therefore has an inhibitory effect on the central nervous system, which creates clinical manifestations mentioned here. We'll talk about the pharmacodynamics of benzodiazepines, and pharmacodynamics implies the effects on the organ system. And on the central nervous system, we know that benzodiazepines decrease the neuronal activity and therefore decreases your cerebral metabolic rate of oxygen consumption. So there's a decreased CMRO2, and due to a decreased CMRO2, there's a decrease in cerebral blood flow. And as you decrease the blood flow to the brain, there's ultimately a decrease in cerebral blood volume that results in a decreased intracranial pressure. So this may be a beneficial effect or a protective effect on the central nervous system that was created by benzodiazepines. Other pharmacodynamic effects of benzodiazepines would be on the cardiovascular system. Generally speaking, benzodiazepines have minimal change on the hemodynamics. But if you were to give a large dose or an induction dose of benzodiazepines, this may decrease your mean arterial pressure, mainly because of a decreased systemic vascular resistance. So if you get a decreased systemic vascular resistance or a vasodilatation effect, this would decrease your systemic vascular resistance and therefore decrease your mean arterial pressure. This decreased mean arterial pressure may be exaggerated in patients who are severely hypovolemic. And hypovolemic patients generally have a decreased preload that's returning back to the heart. And preload is also thought of as your left ventricular end diastolic volume. So with the decreased left ventricular end diastolic volume, or your preload, this also reduces your cardiac output and ultimately may decrease your mean arterial pressure. So therefore, benzodiazepines may affect your cardiovascular system and may exaggerate the effects of decreased mean arterial pressure in patients who are severely hypovolemic. And interestingly enough, certain patients, such as heart failure patients, who may be congested or fluid overloaded, may actually be beneficial or may benefit by benzodiazepines in the sense that it may reduce the systemic vascular resistance and decrease your afterload. The respiratory system is affected in regards to being dose-dependent respiratory depression. That benzodiazepines, as you increase the dose of benzodiazepines, it has an increasing respiratory depressant effect. So generally speaking, if you were to give a sedative dose to a relatively healthy patient, this should have a minimal change on the respiratory status of the patient. But as you increase the dose from, let's say, a sedation dose to an induction dose for general anesthesia, this may decrease your respiratory drive. And this also can be explained in certain patients that have a chronic respiratory depression. For example, patients with chronic obstructive pulmonary disease or central apnea, they may have an exaggerated respiratory depressant effect once given benzodiazepines. So this implies the pharmacodynamics of benzodiazepines, which basically explains what the class of drug, or what effect does the class of drug have on the major organ systems of the body. Pharmacokinetics implies how does the body treat the drug in the sense of absorption, distribution, biotransformation, and excretion. So basically, benzodiazepines are generally given intravenously. And intravenous injection of diazepam and lorazepam are generally considered very painful, and that's due to the lipid solubility of lorazepam and diazepam. Midazolam is different because it has two structures, an open ring structure and a closed ring structure. But once midazolam is introduced into the body intravenously, it transforms from a water-soluble state into a lipid-soluble state. And because all these drugs are lipid-soluble, there's an attraction to the central nervous system, because the central nervous system's phospholipid bilayer, which we showed here, this phospholipid bilayer allows the entry and the absorption of benzodiazepines. So due to the high lipid solubility of benzodiazepines, there's relatively a rapid onset, and primarily and especially for midazolam because of its high lipid solubility. The biotransformation of benzodiazepines, for example midazolam and diazepam, takes place within the hepatic system or the liver through a process of phase 1 and phase 2 reactions. The phase 1 reaction is involved with the oxidation reduction of the parent molecule such as midazolam, and phase 2 reaction is more involved with the conjugation. So for example, midazolam is biotransformed into its metabolite 1-hydroxymethylmidazolam, which still has some CNS depressant effect, although it's more mild than the parent molecule. And due to the now more water-soluble element of this metabolite, it's therefore able to be excreted via the kidneys. Diazepam is a little bit different in the sense that the biotransformation of diazepam creates two active metabolites which still has the CNS depressant effects. Therefore, it goes through a secondary conjugation phase which helps to inactivate the metabolite and helps to create a water-soluble metabolite which therefore can be excreted through the kidneys via the urine. The interesting thing about midazolam, as far as the hepatic clearance, is that midazolam is about 10 times more rapidly cleared than diazepam, and it's about 5 times more rapidly cleared than lorazepam. So this explains why midazolam is often used for one of the pre-medications for induction of general anesthesia. And we'll talk about more in greater detail the pharmacodynamics and kinetics of the benzodiazepines, which includes midazolam, diazepam, and lorazepam. And in the next lecture, we'll talk about the barbiturates and the other class of drugs that stimulates the GABA-A receptors that creates an inhibitory effect on the central nervous system and therefore produces or creates a sedative hypnotic effect. So we talked about benzodiazepines, and we'll continue talking about barbiturates, propofol, and etomidate in respects to stimulating the GABA-A receptor and ultimately creating clinical effects of sedation.